This is female pelvis, and the diameters of female pelvis is most important question and favorite questions of your external practical examiner. So today in this video we will discuss about diameters of female pelvis. In female pelvis, there are brim or inlet of the pelvis, cavity of the pelvis and outlet of the pelvis. You will study diameter of brim, diameter of cavity and diameter of outlet of the pelvis. First we will study about diameters of brim. In diameters of brim there are anterior posterior diameter of pelvic brim, oblique diameter of pelvic brim and transverse diameter of pelvic brim. First we will study about anterior posterior diameter of pelvic brim. Anterior posterior diameter of pelvic brim extend from the middle of the sacral promontory to upper border of the symphysis pubis. And there are three types of diameter. One is true conjugate, second obstetric conjugate, third diagonal conjugate. So true conjugate, the diameter of the true conjugate. The diameter extends from the middle of the sacral promontory. The diameter extends from the middle of the sacral promontory. This is sacral promontory, the prominent part of the sacrum. This is sacral promontory. So the diameter extends from the middle of the sacral promontory to anterior upper part of the symphysis pubis. Okay. The diameter extends from the middle part of the sacral promontory to anterior upper border of the symphysis pubis is called anterior posterior diameter, and it is true conjugate. Okay, and it is true conjugate is 11 centimeter. The diameter of true conjugate is 11 cm. Next, another one diameter is also there, that is obstetric conjugate. The same point starting from same sacral promontory point. Okay, the diameter extends from the middle of the sacral promontory to middle of the sacral promontory to middle of the symphysis pubis. This is, you can see this portion is symphysis pubis. Okay, posterior part of the symphysis pubis. Okay, the diameter extends from the sacral promontory, middle of the sacral promontory to, okay, middle of the symphysis pubis, not upper border. Okay, upper border is called true conjugate. The diameter extends from the sacral promontory to upper border of the symphysis pubis is called true conjugate, and it is 11 centimeter diameter. And the diameter extends from the middle of the sacral promontory to middle of the symphysis pubis, middle of the symphysis pubis, not upper border. So it is called obstetric conjugate, and it is 10 centimeter. Okay, it is 10 cm. Next anterior posterior diameter is diagonal conjugate. Okay, what is diagonal conjugate? So the diameter extend from the same point. Okay, the diameter extend from the sacral promontory, middle of the sacral promontory to lower border of the symphysis pubis. This is lower border of the symphysis pubis. So the diameter extend from the sacral promontory to this. Okay, lower border of the symphysis pubis, lower border of the symphysis pubis. This is diameter extend from the sacral promontory to lower border of the symphysis pubis. This is called diagonal conjugate. Okay, the diagonal conjugate we can measure. Diagonal conjugate we can measure. Okay, so diagonal conjugate is 12 cm. Now we finished anterior posterior diameter of the pelvic brim. We'll discuss now oblique diameter of the pelvic brim. Okay, we'll discuss now oblique diameter of the pelvic brim. So what is oblique? This is oblique diameter of the pelvic brim. Okay, this is oblique diameter of the pelvic brim. So the diameter extend from the sacroiliac joint. This is sacrum and this is ilium. Okay, between sacrum and ilium you can see the joint here. Okay, this joint is called sacroiliac joint. Okay, the diameter extend from the sacroiliac joint to here you can see iliopectineal eminence. Okay, iliopectineal eminence. This is ilium and this is pubis. Okay, the ilium and pubis joins here and form prominent part. This is called iliopectineal eminence. So the diameter extend from the, this is sacroiliac joint, extend from the sacroiliac joint to iliopectineal eminence. Okay, this diameter, sacroiliac joint to, see, this is oblique diameter. Okay, the diameter extend from the like this. Okay, extend from the sacroiliac joint to here in opposite side. This is iliopectineal eminence. This is oblique diameter and it is 12 centimeter. Okay, same you can get also another one here. This is also oblique diameter and this is sacroiliac joint. The joint diameter extend from the sacroiliac joint to iliopectineal eminence. This is called also oblique diameter and it is also 12 centimeter. Okay, and the transverse diameter of pelvic brim. Okay, we finished anterior posterior diameter of pelvic brim and finished oblique diameter of pelvic brim, and now anterior already finished. Okay, now we'll discuss about transverse diameter of pelvic brim. So you can see this is iliopectineal line. Okay, this is this part you can see this is iliopectineal line. Okay, here this is iliopectineal line and this is also iliopectineal line. So the diameter, the furthest diameter between these iliopectineal lines, okay, called transverse diameter, this diameter. Okay, transverse diameter which is 13 centimeter. Okay, which is 13 centimeter. Okay, which is 13 centimeter. Transverse diameter like this. Okay, between two furthest line of the here, between two iliopectineal lines, the diameter is called transverse diameter and it is 13 centimeter. Okay, now we finished diameter of pelvic brim. Okay, we'll discuss now diameter of pelvic cavity. So below the pelvic brim there is pelvic cavity. Okay, below the pelvic brim there is pelvic cavity, and the diameter of pelvic cavity, the diameter of anterior posterior diameter of pelvic cavity 12 cm, and oblique diameter of pelvic cavity also 12 cm, and transverse diameter of the pelvic cavity also 12 cm, all are equal. Okay, so next we'll study about this is, okay, this is outlet of the pelvis. Outlet of the pelvis is diamond shape. You can see this is posterior part of the symphysis pubis and this is coccyx, this is sacrum, okay, this is coccyx, this is ischial tuberosity, okay. If you can see, this is like this, okay, this is diamond shape, okay, diamond shape. So in outlet you can get anterior posterior diameter and transverse diameter only, okay. In outlet you can get anterior posterior diameter and transverse diameter only. So here you can see the anterior posterior diameter of outlet. This is, you can see, this is sacrum and this is this is sacrum and this is coccyx, okay. The joint between sacrum and coccyx, from that place the diameter extends from the sacrococcygeal joint, you can say that sacrococcygeal joint, or apex of the sacrum, okay. The diameter extends from the apex of the sacrum to this is apex of the sacrum to lower border of the symphysis pubis, this diameter, okay. Apex of the sacrum to lower border of the symphysis pubis, this is anterior posterior diameter. See, this is apex of the sacrum. The diameter extends from the apex of the sacrum to lower border of the symphysis pubis. This is anterior posterior diameter of clit and it is 13 centimeter, okay. And the transverse diameter you can see, this is ischial spine and this is also ischial spine, okay. This is ischial spine and this is also ischial spine, two ischial spine. So the diameter extends between these two ischial spine, okay. This is bispinous diameter, okay. This is bispinous diameter which is 11 cm, okay. And you can also here get another diameter, this is bituberous diameter, ischial tuberosity, and this is also ischial tuberosity, and between two tuberosity the diameter is bituberous diameter, okay. So all these are diameters of the female pelvis. So thank you for watching this video.